Hi there, I am here. It is the end of May, and I just got off of a Facebook Live chat, and I just wanted to jump on over here to YouTube and see what this was about. So, not everyone's on Facebook. I realized that I would like to do a little bit more live chat with people being here live. So, we just went over a book, just in case you're not on Facebook. I just talked a little bit about this book. And if you were on Facebook, I'm sorry, you've seen this book like 20 times. But it is Don't Let Your Doctor Kill You by Erica Schwartz, who is an MD. And the reason why I'm sharing this book with you is because it was an easy read. It wasn't anything that we don't know already, that the medical system seems to be breaking down. It's really hard to find a doctor now who isn't like a really good like general practitioner, like the old days where they'd come and they'd sit in your living room and see how you're living and ask you how you're doing and what your life is like, and then they deal with your medical problem. Where today it's you go into an office, you may wait for a long time, you see someone for 2 seconds, they barely look at you, they're just typing into a computer, and then you leave with medicine, and then you're dealing with insurance companies. That might be a little bit extreme, but it's really not that extreme. And the same thing is happening with our pet care, our pet health. And I see veterinary hospitals are changing. There are a lot more specialties out there, which is great on one hand because we get a lot of answers and maybe a lot of cures. But at the same time, it's not so great because a lot of these chronic conditions, a lot of this medical treatment might be doing more harm than good. And that is one thing that we don't want to do is more harm to our pets. We want to have them have a good quality of life. We want them to be comfortable. We want them to enjoy things. And if medicine can help us with that, that's great. But once medicine is doing more harm, if you're bringing your pet into the doctor consistently, or really into the emergency room consistently for some chronic condition, if you're constantly trying to feed them and they're not eating, or they're sick with vomiting and diarrhea and medication is not controlling it, and test after test is not really showing anything, and there's really no cure, and your veterinarian keeps sending you to specialists, it might be time to kind of take a step back and say what's going on here and take a different perspective. A lot of times when people feel like they're at the end of the road, that's when they come to me. Either their veterinarian will recommend me, or they'll find me online as a last-ditch effort. And what happens at that point is either the pet is very sick and we give them a better quality of life for the remaining time, or it's a different perspective. I'm a different perspective. I'm a pet nurse. I'm not a veterinarian. And I actually chose to be that. My career path was to become a veterinarian. And at some point when I was working at the animal hospital, I realized I want to be the spokesperson for the pets. I like the hands-on with the patient. I like that part of it. And that role now gives me a different perspective on individual pets' healthcare. So when I step into the picture on a home visit, I get to see the environment that the pet is living in. I get to see their personality a little bit differently than if they were brought into a busy animal clinic. And I get to see how they're being fed and what they're being fed and what their environment's like and how they're living and what their routine is. That's all really, really, really useful information. And a lot of times the pets I see that are on their last leg actually make a turnaround, and they do really well for months, years. It's sometimes incredible. And it has a lot to do with having a different perspective. So if you're seeing a specialist or a doctor and things are not really going anywhere, seek out, you want to seek out a second opinion that's a different opinion. So you don't want to go to the same type of specialist or the same type of doctor or the same type of treatment type of thing. So you'd want to seek out something that's different and get a different opinion from a different perspective. So I think that is it for now. I just wanted to test this out, and I'm hoping that this is useful. And I hope to use this platform in the future so that we can have more people joining our live talks. I just want to see too if yeah, okay, so I think I can see like comments and things. Oop, I think I popped off for a second. So I think I can see the comments if someone were to join in here. So I'm going to try to do this in the future. Oh, I just want to show you. So I just showed this on the Facebook Live, but this is my little yarrow plant that I am very enamored with today. And it's just starting out. This is about 3 days old. So this is yarrow. It's an herb that I use all the time. I use it year round for a lot of different conditions. So this is something, if you know me, you'll see more of this. Okay. Hope to see you soon, and I hope this helps, and have a good rest of the day. See you soon.